Well, the benefit for a patient who's to be able to be seen at home is that it makes access incredibly easy, right? It just does, right? And it's respectful for their time. I have several people that live quite a distance. They're elderly. Transportation is difficult for them. A patient I saw just yesterday, someone lives in Schuylkill County and does not have the ability to drive or get transportation. This person needed to see me and we were able to arrange a visit on pretty short notice, right? And that person is perfectly happy with it. I was able to deliver the same quality of care, the same decision making, which is the most important part of what we do. If somebody's at home, then the traditional physical exam is not something that we're doing. So I'm not putting a stethoscope on somebody's chest, right? That is the one thing we can't do with a visit like this. However, the visual cues of what we get and seeing the patient's facial expressions, their body language, and seeing their environment, that adds so much more to the visit. What are things like for them in their home? Or they could show us around their home if we have questions about things that they might be exposed to in the home that might be causing their symptoms. If we find that there's a televideo visit really is not appropriate, or maybe we need to supplement what we've already learned with an in-person visit, we'll do one of two things. We could have the person arrange to come in for an in-person visit. We still do in-person visits, of course. Or we'll have them go to a hub where we can actually use peripheral equipment, electronic stethoscope, other types of equipment to augment our exam with somebody helping us at the distant site. It's respectful for their time, and people are finding out is a very effective way to deliver care. And so I think this is here to stay, right? And I think it's going to keep growing. We really want to be able to bring specialty medicine throughout our entire system. We don't only want it to be at our central main hospitals, and we want it to be able to, for people for easy access no matter where they live. And practically speaking, if you live a few hours away, it's hard, right? With this, it's at their doorstep. Right, the same high-level tertiary care they could get in a main center, they could get sitting at home. One option for somebody who really has no access to a smartphone or to a computer is to go to one of our local clinics. We've set up clinic ability to do this throughout the system, and so that still allows people to be close to home and not have to come all the way into one of our main centers. The other is that, almost everybody has at least one relative that has a smartphone, and being able to do these on smartphones has really been a game changer. One doesn't need a sophisticated computer to do this, doesn't need sophisticated cameras. A smartphone is perfectly fine. It's no more complicated than doing FaceTime. It's really easy. I found the patients love this. Once they see how easy it is to click on a link and do it, they love it. Okay, and again, that ability to just roll out of bed and come to an appointment without having to go through all the trouble. One of my favorite examples of this was somebody who I saw. It was a 7 o'clock appointment in the morning, and arranged to see this person. They called in from the parking lot of their workplace because they were able to call in just before they started the work shift. No lost wages, no lost time. It was absolutely perfect. They were really happy with the visit. So yeah, in general, people really like this. And I've had virtually no trouble getting somebody who was at an in-person visit say, how about we do a video visit the next time? Once they do it, that's all they want to do. I think that not only me, but I think many, many of my colleagues across the country think this is the future that's been waiting to happen. And in many parts of the country, in many markets, this is how healthcare is being delivered, where people don't take all that time, a half a day to go to a doctor or whatever else. Okay, this is how it's being done. I would love to say that my ability to put a stethoscope on their chest is the most important part of what we're doing. It isn't. The most important part of what we do is hearing what the patient has to say, putting that in the context of all the other information that we have about them, making a decision about what the next step is. That's the essence of medicine, and we can do that extremely effectively by televideo.